Hi, it's Stephanie again. Let's discuss adult rescue breathing for the healthcare professional. Rescue breathing is used to help prevent brain damage and death. It is used when a person is unresponsive and not breathing normally but has a pulse. First, check scene safety and don personal protective equipment such as gloves and a mask with a one-way valve if possible. Check for a pulse, and if there isn't one, then start CPR. Then, to check for a response, ask the person if they are all right and tap them on the shoulder. Call EMS or call a code and have people nearby call 911 and bring you an AED. Begin rescue breathing. Tilt the head and lift the chin to look for signs of normal breathing. Check for a pulse for no more than 10 seconds. The person may have a pulse but is not breathing normally. This includes agonal breathing, which is a sort of gasping, labored breathing that is not considered normal. For adults, give rescue breaths at a rate of 1 every 5 seconds. After 2 minutes, check for a carotid pulse, and if there isn't one, then start CPR. To check the carotid pulse, place 2 fingers between the trachea and the sternocleidomastoid muscle. If there is still a pulse but they are not breathing normally, then continue rescue breathing until EMS arrives. Watch for chest rise during rescue breathing and reposition as necessary. Have an AED ready in case the pulse is lost too. Keep reassessing pulse and breathing every 2 minutes until help arrives or the patient resumes breathing spontaneously. This concludes adult rescue breathing. Thank you for watching.